You had a C-section and you still have a burning or tingling sensation around your scar, lower back pain, bloating. That is not normal recovery. And today I'm going to tell you when exactly you have to go to an osteopath and what that osteopath can do for your symptoms after a C-section. Hi, I'm Sebs, pediatric osteopath and full-time dad. Many moms have symptoms after C-section for years, so you're not alone. Don't worry, we're going to talk about what symptoms these might be and when you have to go and take care of these. As many of you might know, C-section cuts through many layers of the skin all the way down to your uterus. A lot of layers that have to reconnect after the C-section. So even when the scar looks like it healed well, deep down there might be issues like adhesions, fixations, general tightness of the deeper layers of the scar that then can cause issues that we will talk about right now. Sign number 1, when you have a tingling or burning or a tight kind of sensation around your scar, especially when you get up and you stretch or bring tension onto your abdomen and your scar by twisting or overarching your back, that's when the scar is not fully recovered and you have to work on it. Symptom number 2, chronologically after your C-section, you started to develop lower back pain. Oftentimes the sacroiliac joint can be also a little bit further up and can also develop into some sort of sensation that pulls into your lower abdomen from the back as well. Symptom number 3, you developed digestive issues after your C-section. Constipation, bloating, cramps, or a general heavy feeling in your lower abdomen. Sign number 4, you feel kind of weak or disconnected in your core after your C-section, even though you started with exercises. Symptom number 5, you developed a tight feeling in your pelvic floor or a painful, maybe burning sensation during intercourse. Sign number 6, you developed a difficulty taking a deep breath. This is because of the fixation of your scar translating up via your psoas into your diaphragm, and because that is tight, you cannot breathe in well. Sign number 7, you developed a postural habit that feels like you cannot open up your body overall and you're always slouched kind of in this position. That also can be fixed. Sign number 8, when touching your scar, it feels very hard, almost like a sort of rope going on, and is also hypersensitive. All these symptoms point toward a not fully recovered C-section scar. And this C-section scar in the deep layers can build real adhesions, fascial tightness, and that can fixate not only your uterus, but also your bladder and your intestines to the whole lower part of that deep scar. So what does an osteopath actually do in these cases? There are many approaches to it, and it's a very big and broad topic, but typical approaches include mobilization of the scar itself or mobilization of the organs that are connected with the scar. Soft tissue and myofascial release techniques. These soften up the scar and the fascia that got really, really tight and cramped up because of the fixated pulling nature of the scar. Assessment and treatment of the pelvic floor, pelvic diaphragm, and the connected part of your pelvis in general. That includes your sacroiliac joints and in general your lumbar spine. Also assessment of the thoracic cage and its diaphragm that connect the lower part of your pelvis to the upper part of your thoracic rib cage. Also help your breathing mechanism to work fully again. And also reconnect your body's core to feel strong again. The goal is not just to restore your scar superficially, but also help your body reconnect, restore your body's full health so that you can breathe and walk and do everything again in a full mobile capability. One small medical note, osteopaths work complementary. That means always do approach your midwives and your obstetricians. We work together and not independently. If any of these symptoms sound familiar to you, even a year after your C-section, it is definitely worth getting them assessed and checked out by an osteopath. If you found this video helpful, like and comment underneath the video with how long after C-section you may have still had these symptoms. Also, we'd appreciate it if you would share it with anybody to whom this video could still be relevant. Until next week, see you then and take care. This video is for educational purposes only and is not medical advice.